people are isolated at their homes, and generally the people are living in a nuclear family, so they don't have people in the family itself to interact.
Here, it is very important as parents to first build a connect with the child. Start looking at all the positive things that your son has done.
Get him involved in some of the routines that may be interesting.
I think Parenting has this wonderful concept of called Parenting Live workshops. What's the objective of reaching out to Parenting?
So it is very important for child to listen a lot.
इतना समय हम इस पे बिताएंगे, इतना समय ये करने में बिताएंगे, थोड़ा बहुत ये स्ट्रक्चर लाना बहुत जरूरी है.
Good afternoon, everyone. Welcome to today's workshop. The topic for this workshop is how to prevent tooth decay in your child. And to discuss that, we have with us pediatric dentist Dr. Saranya K. Thank you, Dr. Saranya, for joining us today.
Hi, Shalini. Thank you for having me.
Our pleasure. Dr. Saranya, to start with, what is a tooth decay? And if you could just focus on the causes of tooth decay in children.
So tooth decay is basically when the structure of the tooth gets damaged because of germs sitting on it. When you have, when there is some bacteria build up on the tooth and the layers of tooth start getting eroded, that is when tooth decay starts. It starts with a white color spot on the tooth, which slowly goes on to become brown. When it takes up food colors, then it becomes a hole in the tooth. So this is basically what is tooth decay, when it's a hole. And if at that stage, it is still easy to fill it up, but then when it gets deeper, it just goes into a bigger tooth decay.
Right. And what are some signs of tooth decay in children?
The first sign you can see is, like I said, there is a bright white spot on the tooth. That is your first indication that something is going wrong on the surface. It's when all the minerals of the tooth have started coming out, because there is a constant attack with all the acids that are generally produced in the mouth when food gets digested. And when the food remains stuck on the tooth surface, the acid attack is even more severe. So the first sign you will see is bright white spots on the teeth, which will slowly turn to brown. This is your very initial stage.
Thank you. Thank you, Dr. Saranya. We have a question from Shirley, and Shirley has a 3-year-old son. She's asking this from Bangalore. Shirley says, my son, who's 3 years old, he's 3 years old, but he does not brush his teeth properly. And he also does not allow me to brush his teeth as well. He loves everything made of sugar. I am not able to control him or stop him from taking so much of sugar. He's sort of become more addicted to chocolates and sweets. Now, how can I prevent his teeth from decay and control this sugar addiction?
Hi, Shirley. So a 3-year-old is not going to brush his teeth by his own. So what you can do is you have to either motivate your kid, or you'll have to stand with your kid, show your child that it's normal to brush, it's good to brush, or probably brush with the child, or let the child first experiment with a brush in your mouth. So when there is a little bit of exploration, and when they understand that it is important, and when the parent is also doing the same thing, they will try to at least imitate you. So when you let them do something for you, probably your child will let you also brush their teeth and allow the whole brushing process to happen. Now, sweet craving, if it is already there, it is very hard to stop. You have to forcibly limit it. There is no way a child is normally going to give up a sweet craving. It's there with most children, so you just can't tell them to stop eating. You have to curb it, or one other thing you can do is you can start giving it as a dessert just after a meal. Instead of giving it in between during the day multiple times, you can limit it, like it's the dessert, you only get it after a particular meal. Say after lunch, you get one piece of some form of sugar, sweet or dessert, anything. So the lesser frequency of sugar intake, you can again reduce the risk of decay. And if during that time your child is taking up sugar a lot, then you can just make sure that after every time sugar is going in the mouth, your child is rinsing or brushing, and you make sure that the sugar does not remain stuck on the teeth anywhere. As long as it is flushed out, you don't have so much of a risk for decay.
Thank you. Thank you, Dr. Saranya. Hope, Shirley, that answers your question. If you, in case you have any other thing to ask, please comment to us and we'll take it up. Aarti Gupta has a 2-year-old, and Aarti is from Delhi. She says, please suggest what kind of toothpastes should I use for my 2-year-old child? She's also saying her teeth is decaying, and doctors are telling to put caps, and even one doctor told for a root canal treatment. What should I do?
So, if your child is 2, you can obviously not move. Your child is probably still eating away the toothpaste. So, what you can do is either try using a toothpaste which does not have much of flavor, so that the swallowing habit goes away. And once the swallowing habit goes away and the child is ready to spit out all the foam and lather that is there in the mouth, you can slowly transition to an adult toothpaste. Now, during this transition, there will be a lot of resistance, but then moving to an adult toothpaste just makes sure that you're getting a higher dose of fluoride that can prevent decay. Now, since you've already noticed that decay is there, you're aware of it, you've already taken a consult, caps are a good option if there is decay on multiple surfaces of the same tooth. Instead of putting, so if you have a tooth and 70% surfaces of it is decay, or more than 50% is decay, you'll end up doing too many fillings on the teeth, and the strength of the tooth is going to come down, because a filling can never take the biting force a normal healthy tooth can. In such cases, a cap is a better option because it uniformly restores the function and strength of the tooth. It's easier for you to bite on a cap as compared to a tooth with multiple fillings on it. Again, if the cavity has gone really deep, where when we clean, if the innermost part of the tooth is going to get exposed, in that case, it is better to go for a root canal. We always take x-rays and check in multiple ways to make sure that root canal or pulpectomy, like we call it, is the only possible treatment option. Only in severe cases do we go for pulpectomy, but then it is very normal to get that procedure. A lot of kids get it. It's nothing very scary. It's slightly longer and multiple appointment procedure as compared to a regular small filling, but in the long term, there's not going to be any other issue in that too.
Thank you, Dr. Saranya. Aarti, we hope that answers your question. Anupam Gupta has a 16-month-old daughter. Anupam is asking this from Pune. Hi, Anupam. Hope you're doing good. Anupam says, my daughter hasn't got her first tooth yet. Does this require any sort of treatment? What foods can be given which will help her in the teething process?
Okay. Hi, Anupam. So 16-month-old, it's okay. Some children do get their teeth a little after 1.5 years of age. But if you're really paranoid, you can just check with the vitamin D levels. Sometimes a deficiency in vitamin D can also delay the tooth eruption. But otherwise, there is no major issue. You should just check if there is a bulge in the lower front or upper front teeth area. If you can see a light or a pale bulge on the gums of your child, then probably the tooth is just coming out. In case you notice any other bluish discoloration or a very thick band of tissue where the tooth is supposed to come through, sometimes we might have to just give a small cut there to clear that out and let the tooth come out. But that is a very rare thing. Instead, you can start giving some frozen, not frozen, but some cold vegetables. You can put a carrot, pieces of carrot, big pieces of carrot in the fridge, or apple in the fridge, and ask the child to just chew on it, nibble on it. That will again improve the blood circulation, or you can use your finger to just massage the area. That will improve the blood circulation and it will make sure the tooth comes out. But 16 months is okay. It might come out in a couple of months. It's nothing to be very scared of.
Thank you so much, Dr. Saranya. We are talking about how to prevent tooth decay in your child in this workshop today. We are with pediatric dentist Dr. Saranya K. If you have any questions, please ask them in the comments below and we'll take them up. it would be great if you could also mention the age of your child, because that will help us give you a detailed answer. I'll move on to Pratik Sani's question. Pratik says, my daughter is fond of gums and marshmallows. She drools a lot even while sleeping. Could there be a connection between the two? Please suggest. She's 3.5 years old.
Hi Pratik. So if your child is, unless the child is sleeping with the marshmallows and everything in the mouth or something sugary in the mouth, drooling is not directly linked to it. But since if the child is sleeping with some form of food in the mouth, that can trigger saliva production, which can come out as drooling. So unless the child is sleeping with something in mouth, drooling and sweet is not connected directly. So if there is a habit on chewing gums, you can try and replace it with sugar-free or xylitol gums. If it cannot be entirely stopped, you can move towards a sugar-free option. And yes, marshmallows are something that can increase the risk of decay because it melts in your mouth and then it sticks there. It is candy end of the day, so it's going to stick on all your teeth surfaces. And unless it's brushed out, it is going to increase the risk of decay. Drooling is not directly linked. Sometimes drooling is normal, but then you have to just see if your child is sleeping with their mouth open. Sometimes keeping the mouth open is a sign of some other problem. So if the mouth is not open, once in a while there is some drooling, it is okay. Toddlers, it is completely normal for them to have some amount of drooling here, now and then.
Thank you, Dr. Saranya. And this takes me to this question of sugar. And I know you've covered this earlier, but could you just elaborate more on the role of sugar? What is the impact of consuming a lot of sugar on the dental health of a child?
So sugar again is in multiple forms. So if you're taking sugar that immediately dissolves and then you rinse it out or you drink water after it or it melts away and doesn't stick on the teeth, it might not be considered as harmful as something which is sticky and sugary. So say for example, ice cream. Ice cream melts in your mouth and then it just goes in. So that is not going to cause so much harm because after ice cream, you drink some water, you have generally cleared out everything from your mouth. At the same time, if you pick up a candy, for example, marshmallow or any toffees that you get in the market, if you eat any of those, there's always a layer that coats on your teeth. It gets stuck somewhere. And as adults, we tend to be aware of it. We will take it off with our tongue or we go brush it off. But kids generally don't take that much care. So if something is stuck, it remains stuck. Especially if it is during the night time when there is no drinking water, there is no saliva, there is no talking, there is no way there is any saliva, water or anything in the mouth that can naturally flush it out. That piece of sugar is going to remain stuck until morning and then the risk of decay becomes much higher. So to avoid that, if at all sugar has to be taken, so preferably don't take any form of added sugar. Natural sugars are not as harmful as added sugars are. So if your child is taking milk, let it be without any added sugar. Then it's not as harmful as milk which has added sugar in it. Even if the child is in the habit of consuming juices or processed juices where a lot of sugar content is there, it's better if the child can drink it with a straw. That way the juice goes directly in your stomach. It doesn't sit around in your mouth, on your teeth. It doesn't form a layer. So that way you're again minimizing the risk of decay. And if at all, like I mentioned, if sugar has to be given or if the child really needs it, try to give it during meal time so that in that one sitting, everything that has to be eaten is done. Sugar is, your dessert is also taken care of. And after that, the child rinses their mouth and then doesn't take anything for the next couple of hours. So even that way, you can minimize the risk of decay.
Thank you, Dr. Saranya, for really elaborating on the role of sugar. I'll move on to the next question that comes from Shikha. She says, when is the right time to brush a baby's teeth? My sister's son is 11 months old. He's just begun with his teething and sometimes bad breath comes from his mouth. He's on bottle feed and has milk 2 to 3 times at night while sleeping. Could that be the cause for bad breath? Please give some handy tips to deal with this issue. She also says that I have been watching this workshop. Thanks for your valuable suggestions so far.
Thank you, Shikha. Shikha, see, if 11-month-old, I'm assuming the tooth is not out yet. So if most likely the reason for the breath issue that you're telling me is the milk coating on the tongue, it may not be directly related to the teeth per se. So if you can start cleaning the child's tongue, you can use a cotton cloth, you can wrap it on your finger and start cleaning out the tongue, the gums and everything at least 2 times in a day, especially after a feed. And if the child is used to multiple time feeding at night, it is better to have a cloth with you dipped in water and just wipe away as much as you can, because if the tooth is coming out just now, in that case the tooth is very vulnerable to get decay and it progresses at a very fast pace. So if the child is used to nighttime breastfeeding, then it is better to clean up every time after the breastfeeding. Of course, you can't brush, you'll end up waking the child. So you can just try to part the lips and just wipe away a little bit of the exposed part where the tooth is just starting to come out. At this stage, if you start cleaning it early, you can prevent decay from happening. Otherwise, very soon the tooth goes into a completely mottled appearance. You'll feel that the tooth is breaking just as it is coming into the mouth, but that's all because at this stage the hygiene is not taken care of. To train the child, to get the child used to brushing in the future, you can start using a finger brush. Those are silicone brushes that you can wear on your finger, and you can just start. It is not actual brushing, but you can start with training the child by introducing something in their mouths early on. So by the time the child is 1 year, a few months, 4 months, 6 months, when more than 1 or 2 teeth are there in the mouth, you can slowly transition to using infant toothbrush or a slightly bigger toothbrush with a handle and everything. But at this stage, it is very important to start clean the tongue, clean all the surfaces, inner surfaces of the cheek and all the gum pads where the teeth are supposed to start coming out now.
Thank you so much, Dr. Saranya, for answering that. Hope, Shikha, that answers your question. If you have anything else to add, please let us know and we can take that question up. All the best to you and your sister. Dahila Sen says, my 2.5-year-old has 2 cavities in his milk teeth. What is the treatment for the same? Please guide. Also, she says, is tooth extraction the right step at this young age, 2.5 years old child? I'm too concerned for him. He does not eat vegetables and pulses and consumes chocolates, chips, and juices. I think when she says juices, she means packaged juices mainly, and not really vegetables and dals. So, what should be done?
So 2.5, we will honestly not advise extraction unless the decay has gone to a very, very severe stage. Since your child is 2.5, I am assuming that you are talking about the front teeth, because right now the back teeth wouldn't have even come out completely. So if your front teeth are decayed to that extent, it's probably again because of drinking milk at night and then not cleaning off the layer that is stuck on the tooth. If that has happened, worst case, sometimes yes, we do advise extraction. Again, it's the worst case scenario. Other options, if the structure of the tooth is still there, we try to save it with a root canal and a cap, depending on how cooperative the child is, what scenario, and how much infection is there in the tooth. We try to save it with a root canal and a cap, but in worst cases, we remove and we give a space maintainer. So space maintainer is given where we fix something in the front there so that the back teeth don't get pushed in the front and close the gap, so that the permanent teeth or the further milk teeth that are supposed to come in the back, they don't push and close the gap, and the place that is needed for the permanent to come in after 7 or 8 years of age, that tooth can come down in its correct position. So if there is a high affinity towards your sugar and your candies or snacks and everything, first that has to come down. You cannot directly eliminate them from your child's diet, but you can bring down the frequency. Like I mentioned before, you can limit it to one particular time in a day, and if reduce the frequency of snacking, amount of snacking, or you can just push the child to brush every time they snack. They get so irritated with brushing generally that they reduce the frequency of snacking. This is what parents gave me as feedback. So if you push them to keep rinsing, keep brushing, the frequency of snacking also comes down. So if you control that, most of the decay will go away. But if it is extraction, that means the infection has already gone to a very severe level, and somebody has prescribed a very that's probably the only option they had.
Thank you. Thank you so much, Dr. Saranya, for answering that. We are joined by Parentune expert Dr. Saranya K, pediatric dentist, to talk about how to prevent tooth decay in your child in this Parentune workshop. Please ask your questions in the comments below and we'll take them up. Vasundhara says, my child who's 1 year, 1 month old has yellowish enamel. He has been on breast milk since the beginning. He does not let us brush his teeth. What according to you is how should I choose the right toothpaste for him? How should I choose the right toothbrush for him? As well as method of making such a child brush his teeth. She also wants to know some steps and strategies that they could follow to make the child brush the teeth.
Okay, so at that age, child is not going to brush on their own. It has to be a forced effort from the parent. It's like when the child doesn't eat, we just don't let the child go away. We somehow force feed them. Similarly, brushing has to just go in routine. So if the parents have a routine, they set a routine, they do it, the child watches them do it regularly, you can somehow force them or bring them together when you are brushing, make them watch you, or probably there are a lot of interactive videos on YouTube these days where there are animations and there are cartoons which guide the child or entertain the child when they are brushing, or probably make it a game time. A lot of kids like that sand timer. They like to flip it and brush for 2 minutes. So as long as it's a little entertaining, the child might get into the routine. And if the parent does it along with the child, it somehow works better for the child also. Now, if the child is completely if you're noticing yellow stains on the teeth, then that is probably you're already in the second stage of decay. So if there is no hole, there is some preventive treatment options we generally suggest in clinic. So if you go to a pediatric dentist, we can just evaluate how severe the decay is. Yellow stains is generally not very severe. We can do something so that it does not go into the next stage. So you've probably gone from white spots, which has now taken up all your food pigments, and there is a little more decay that has happened and that has turned yellow. So at this stage, we can still avoid drilling and filling and all those bigger procedures. Some preventive procedures can take care. You can start with a kid's toothpaste, but again, kid's toothpaste is very fruit flavored, strawberry and jam, jelly flavored, so the risk of swallowing is there. So start with that, or there are some non-flavored, less fluoride or no fluoride toothpaste also you can initially start with, where the child can first get used to the habit of brushing, move on to your basic kids toothpaste, and then slowly you have to transition your child later on after 4 years of age to an adult toothpaste. So initially start with any kids toothpaste that you get in the market, your Colgate, Pepsodent, everything, Chico, all of these brands have kids toothpaste. So you can take whatever works for you, whatever flavor works for the child. First, we have to take something which is a little compatible with the child. So if your child likes strawberry, pick strawberry. If your child likes Superman, pick Superman. And motivate the child, encourage the child to brush, or probably you can have 2 toothbrushes. Keep one for the child to play with in the mouth, and one for the actual brushing. You can't have the same thing because children tend to chew away toothbrushes. So it has to become a part of their playtime routine or something for them to get into the habit of brushing.
Right. Thank you. Thank you so much, Dr. Saranya, for answering that. Kiyati Khanna says, my 2-year, 8-month-old daughter often complains of toothache. She does not brush her teeth properly. She's quite energetic and playful and does not even let us brush her teeth. Her teeth seem to be very weak and small in size as per her age. What food can be given to her to make her teeth stronger and also remove the pain that she complains of quite frequently? Thank you.
Hi, Kathy. So, if your child is not letting you brush, probably it's because of the pain she already has. There is pain there, and toothbrushing is giving her some amount of discomfort when the brush touches there or grazes against the gums. So, it's probably giving her pain. That is why she's becoming aversive to brushing. So, if she's recently stopped brushing, this could be the reason. If she's never brushed properly, then again it has to become a routine and a forced event, and she has to start brushing. But sometimes, when there is multiple decay, children don't understand when there is sensitivity and when there is pain. They really cannot differentiate between the two. And also, their pain and sensitivity does not come as early as it comes for adults. With adults, even a little break in your enamel or a very, very small decay can also give severe sensitivity. But with children, that kind of sensation does not happen. So if it has come to a point where your daughter is complaining of pain, then definitely the cavity has gone a little too deep and may need a bigger treatment like a root canal or something. But once the pain is gone, once she's comfortable, once she's able to eat comfortably, you can probably then reinforce brushing, because if the procedure of brushing, the taste of the toothpaste can also irritate an already damaged tooth. That can create an aversion towards brushing. So first get the tooth that is damaged, get that treated. If it needs a cap, put a cap, and then again reinstate the habit of brushing. It will be much more comfortable for her.
Thank you. Thank you for answering that. The next question comes from Avani, and Avani has a daughter who will turn 7-year-old soon. She says her permanent teeth are coming, and I feel it's too slow. Like almost 5-6 months, tooth has not come to a proper size. It is still growing. So she wants to know if this is a normal sign and should she give any supplements.
No, I think I missed this in the previous question also. The size of the tooth really does not change with any form of supplements or any changes in diet or any other thing. There is one particular size, it is genetically determined. So the size of the tooth is not going to change ever. It is predetermined. But a big tooth becoming small tooth is just because it is breaking away because some decay has happened there. Now, permanent teeth, if it is coming out, it is coming slow, it is fine. It will take around a year and a half. So the child is 7. It is probably just started coming in. Give it another year or so. By 8, generally the bite and everything settles in. So it's really not a hurry. As long as there is no pain, hygiene in that area is good, and there is no discomfort, no swelling of the gums in that region, no gums covering the surface of the tooth that is coming out, there is really nothing to worry about. Just keep rinsing with salt water if there is any discomfort. Mild warm salt water, that will take care and make sure there is no infection around the tooth. The tooth will come out slowly. Generally takes around a year for the tooth to come out and settle into its correct position.
Thank you, Dr. Saranya. Abhi, we hope that answers your question. If you have anything else to ask, please write back here the way you asked this question, and we'll take that up. The next question comes from Rujuta, who has a 2-year-old son. She says, my son got cavity in his front tooth. He does not want to brush also. Please advise me, how should I handle this?
Again, he's probably not brushing because there is already sensitivity in that tooth, and toothpaste is triggering that sensitivity. So make a visit to a pediatric dentist. We generally keep one counseling visit where we don't do any sort of treatment. This counseling is for the parent, not for the child per se. And based on how old the child is and how big the child is, we sit, explain to you how to brush, how to hold the brush. So sometimes the holding of the brush, the way the child is positioned, everything can make a big difference in the comfort and the whole activity of brushing. So once you visit a pediatric dentist, we can just have a counseling session where we just make you stand in front of a mirror with the child, position the child, tell you how to hold the brush, how to keep the lips and the cheek apart, how to make it less irritating for the child. One such session of learning. So brushing for somebody else is way more harder than brushing for yourself. It's a learning curve. So if you try to impose and brush too hard, probably even the bristles of the brush, if it touches the gums, it hurts the gums, the child is going to become reluctant to brush the next time. So it's better if your child is not allowing, something there is irritating the child where they don't want to brush. Either we motivate them, tell them that this has to be done. It's like a routine procedure, like how they get up and bathe and go out or have food or any other routine procedure that they go with through the day. Brushing is just a part of it. So either we motivate them, or if something is going wrong with the technique, you can just connect with any pediatric dentist in your area and we can just have a counseling session to learn how to do it properly.
Thank you, Dr. Saranya. And Dr. Saranya, since we're talking about dental health and brushing and flossing are definitely two of the most important things that you should keep in mind and inculcate in your child's life from the start. Could you also elaborate on this a little? How important is brushing twice a day, or if it is one time a day, and also the importance of flossing, because it is not as common a practice as brushing is. So if you could just talk about that.
So brushing in the morning is pretty much routine. It's something everybody does. Brushing in the night is way more important than the morning, primarily because at night, like I mentioned, there is nothing. During the day, you're talking, you are constantly eating something, you're drinking water, you're aware when something is stuck somewhere, so you go and rinse it out. But at night, if the child is just eating and falling asleep, then whatever is stuck in the teeth is going to remain stuck there until morning. So it's like when you leave food out on the table and it starts rotting, the same rotting, when it happens on the teeth, it kind of eats away a portion of your teeth too. There is a lot of bacteria that grows there. So to avoid that, brushing at night is much more important than brushing at morning. Although both are important, night definitely should not be missed out. Once your teeth are completely cleaned out, then the whole night there is no activity. By morning, your teeth still remain clean. Otherwise, by morning, that is when most kids start complaining of extremely bad breaths in the morning and a lot of that foul smell coming out and all those things. So if you brush at night, clean your tongue properly, you've removed most of the bacteria from the mouth, your risk for decay comes down. Now, flossing again is not required for all children. Most of the milk teeth are placed a little apart. They are not placed too close together. There are gaps in between teeth, which is very normal, which should be there ideally. If there are no gaps, in some children, the teeth are placed too close together. So in such case, your most common area for decay to start is in between the back teeth, your molars. So in between the teeth, when teeth are too close together and food gets stuck in the middle, that is where your decay will first start, and you will start seeing a black line, or children they will shift eating. So if there is food that is getting stuck on one side, if decay has already started, then food is getting stuck there and they slowly start chewing on the other side. That is one of the signs you will notice in the child. Or your child is going to change their food preferences. Suddenly they do not want to eat hard foods anymore. They move from chapatis and parathas, they move to rice, because that's easier to chew. It does not get stuck. It gets flushed out easily. When there is a sudden change in eating patterns, you should look out for cavities in the mouth. So if something like that is there, when the teeth are too close together, we advise flossing. And we make sure that with flossing, you clean out everything that is stuck in between, especially the back teeth. Or the other time when we mandatorily advise flossing is when your front teeth come out and they are not in the right position. If they are moving, if they are placed one front and one back and so on and so forth, then cleaning becomes a little difficult with a regular brush. Especially in younger kids, they can't maneuver the brush that easily in the mouth. So flossing becomes an easier option to make sure that nothing is stuck there.
Thank you, Dr. Saranya, for talking about the importance of brushing and flossing. We are joined by parent-tune expert Dr. Saranya, pediatric dentist, to talk about how to prevent tooth decay in your child in this parent-tune workshop. Please ask your questions in the comments below and we'll take them up. The next question comes from Lubna. And Lubna says, my child is a picky eater. He only wants to have pasta, noodles, Maggi, fried food, and chocolate milk. He's 3 years old and he has cavities in his teeth. What can be done? Please guide me. How should I help this?
Hi, Lubna. So picky eating is more like a phase the child goes through. So today it's something, tomorrow it's something else. But that is really not directly linked to decay. Like I said, it's not only pasta that is going to cause decay, or it is not only one particular kind of food that will cause decay. Even your very healthy food, even your chapati, when it is stuck in between teeth or it stays on the teeth for too long, or if the child holds food in mouth for very long before swallowing it, that can also increase the chances of decay. But that said, if there is already decay, and if you have noticed, the decay progress is very, very, very fast in children as compared to adults. So what will take around a year to go from first layer to the second layer in adults it's going to take half the time in children. So if you have already noticed a decay, it is very important to immediately go get it filled, get it cleaned up. If it is not cleaned up, the risk of the bacteria spreading to the other teeth also increases, and it deepening very fast also increases. So it's better to get that filled. Food preferences, like I said, one particular food cannot be said that this is the only one that causes decay unless it is something which has added sugar or something that sticks to your teeth.
Thank you, Dr. Saranya, for answering that. Lubna, we hope that answers your question. Gayatri Bij says, my daughter, who's 9 months old, had her lower jaw front teeth first. I've heard babies usually have the upper two teeth first. Now, is this normal for her daughter to have her lower jaw front teeth first?
Ideally, lower is the first one that comes out. So your daughter is doing perfectly fine, Gayatri. But yes, some kids get upper also first, but there is really no competition there. It's generally the front teeth. That's it. Sometimes it's upper, sometimes it's lower. Don't worry about that. If your upper has already come, the lower is just about to come. It's somewhere there. You can just keep massaging the gum pads. Start brushing the teeth. Start massaging all the gum pads around the erupting tooth, because now the child is going to have severe teething. There's going to be irritation. Your child is going to start putting everything in her mouth, biting on whatever she can lay her hands on. So your task of keeping everything around her extremely clean increases. So don't worry about which tooth comes first. As long as she's okay, she's not getting troubled by the teething, it's perfectly fine whether it's your upper or the lower that comes out.
Thank you. Thank you so much, Dr. Saranya. The next question comes from Roshni Menon. And Roshni says, my daughter, who's 1.5-year-old, cries a lot and remains irritable when tooth eruption takes place. Is this okay? Do all children have such issues while teething? What can be done to ease her pain and make her teething process easier?
Teething is very difficult for most kids, most of them. Almost all of them have trouble when they are teething because it's a little painful when the teeth moves, it tears through the gums and it comes out. It is definitely painful. But what you can do is you can use teethers, good quality teethers. Make sure you sterilize them, you clean them very well before giving it to the child. There are teethers which have gel or something inside. You can put it in the fridge, slightly cool them. When it is a little cold, all that irritation, the inflammation that is happening where the tooth is erupting will slowly subside. It can give, it's soothing basically. What you can only do for your child is soothe the area where the irritation has started. It can really not go away until the tooth completely comes out of the gum. So it is only in the transitional period where the tooth is still trying to peep out of the gums is when the teething pain and irritation and everything is there. A very low grade mild fever is also common in children when they are teething, which like 98, 99 kind of a fever, not very high fever, very, very low grade fever, because they tend to put anything and everything in their mouth. They're chewing on things. If your child has started solids and is comfortable eating raw vegetables, you can put a piece of carrot or apple, anything that is a little hard to chew on, place it in the fridge, give it to them to chew on. Anything which is fibrous, a little hard, can help in soothing down the discomfort, soothing down the inflammation that is happening in that area. If it is really bad and if it is disturbing her night's sleep, you can give probably a 1 dose of paracetamol. According to the child's age and body weight and everything, you can give 1 dose of paracetamol just to keep her comfortable through the night. Otherwise, teethers these days do a very good job at calming down the inflammation that happens during teething.
Thank you, Dr. Saranya, for answering Roshni's question. Roshni, we hope you heard that. Please write back to us in case you have any more questions. Cheena Malik says, what food is advisable to be given to babies after 6 months of age for strong teeth?
So most of the teeth that are going to come out, Sheena, at 6 months, or the first milk teeth that are going to come out were already formed when you were pregnant with your baby. So nothing you give now is going to strengthen the tooth per se. Just make sure the child does not have any deficiencies. Right now, only your child's permanent teeth are forming. So as long as there are no deficiencies, nothing is going to happen. Just give a high fiber diet. Like I said, avoid anything that is sticky. You can avoid damage from happening, but the development that has to happen has already happened. You don't have to give any supplements or any special kind of food to improve the tooth structure. The tooth structure is done, it's ready to come out. All you can do is you can prevent it from going bad. That's it.
Thank you, Dr. Saranya, for answering that. Could you also suggest some prevention tips for tooth decay?
Prevention. The first thing, you have to keep it clean. Anything that is clean does not decay. So brush, floss, if needed. You can also start the child on rinsing, whether with mouthwash or with just plain water, whatever the child is comfortable with. First, that is one thing. Second thing, control the diet, control the frequency of snacking, and don't keep at least like a 2 or 3 hours gap in between two meals, or in between a meal and a snack. If there is too much of snacking, so these days, the COVID, there's no school, kids stay at home for a very long time. They don't have much play time. They don't go out much. They end up snacking every 30 minutes, 1 hour. So snacking has been associated with boredom, pretty much for adults as well. So when they're bored, they end up snacking. So if we can cut all those things down, those habits down, you will significantly reduce the risk of decay. And the kind of food, I keep emphasizing, stick to non-processed, high fiber foods, which will clean off anything that is stuck on the teeth, which will pull away all the food remnants that are stuck on the teeth. And if you feel that food keeps getting stuck in some particular area, get it checked, get it evaluated, why the food is getting stuck there. Sometimes we do preventive things like sealants. We just seal up the grooves that are there on the teeth where food goes and gets stuck very frequently. So when food is not getting stuck, when the grooves are sealed up, again, your risk for decay comes down. So to understand all of this, it is very important that you start seeing a pediatric dentist when the first tooth comes out. So if you've already been practicing and you still see that, no, there is I see some discoloration on the child's tooth, then just take an appointment. We'll tell you exactly what is going wrong for that particular child.
Thank you, Dr. Saranya. That's really helpful. Dr. Saranya, for a 1 to 3 year old child, if you could suggest some tips for parents for healthy for dental hygiene and dental health.
For 1 to 3. So now 1 to 3 is the time when the milk teeth start coming in, and 3 is the age where the milk teeth have settled into the mouth. So 3 to 6, you generally don't see any changes. There are no new teeth coming in. There is no more teething that is happening. 1 it starts, 3 it ends. So you have to start cleaning the mouth even before the first tooth comes in. You can take a cloth, cotton cloth, wrap it around in your finger and start wiping the gum pads on a regular basis. So that way you are also kind of introducing something into your child's mouth. And when the time comes for you to start brushing, they already get used to having something in the mouth on a routine basis. So if you're wiping the gum pads continuously, making sure there is no bacteria buildup, you are ensuring that your child does not become aversive to brushing when the tooth starts coming in. And when the first tooth comes out, irrespective of the age, so some kids get their first tooth by 6 months, some kids get it at 1, some kids get it at 1.5. It really varies. It is not one particular age. Between 6 months to 1.5, your child can get tooth at any time. Whenever that is, you have to immediately start brushing. start with a silicone brush because that is comfortable for the baby. You can move to an infant toothbrush. You can slowly transition to an age-appropriate toothbrush. Just make sure the size of the head of the toothbrush is really small. A big toothbrush will end up hurting the cheeks or the gum somewhere. It will not go till the very end. So a smaller head with a longer handle is better for the parent to hold. Generally, some commercial brands have a regular sized head and a very small handle. A small handle is very uncomfortable for the parent to hold. So a longer handle and a smaller head is much more comfortable. Start that immediately as the first tooth comes into the mouth. So your first toothpaste can be a non-fluoride toothpaste. You even get non-foaming toothpaste because a baby and infant, if the tooth is there at 6 months of age, there is no way a child is going to spit. Your spitting reflex starts a little much later, in fact. So you can start with a non-foaming toothpaste. You can start with a non-fluoridated toothpaste. You can brush, probably keep a cloth handy and just wipe off all the toothpaste so that the child doesn't swallow much. And start at a very young age so that by the time there are 4, 5, 6 teeth in the mouth, the child already knows that, okay, this is something that has to happen and the child can't dodge it, can't avoid it, and you will be able to keep the teeth much cleaner because the child is going to let you brush. So start early, go get your first dental appointment done when the first tooth comes out. Anything that has to be taken care of, any extra preventive measures that have to be taken care of, we can advise you at the right age before any problem develops. And by 3, generally, if everything goes fine, everything is just going to be a maintenance and a counseling visit. That's it.
Thank you, Dr. Saranya, for answering that. I'll take Pooja's question now. And Pooja says, at what age I should introduce brushing? Please suggest the ideal way to do it. You've already covered this, but I believe Pooja's just joined in this workshop. So if you could just give an answer to that.
Okay. Pooja, if the first tooth has come in, start brushing. Again, just start brushing with a baby toothbrush. Use a non-fluoridated toothpaste. Depending on the age, move to a fluoride one, a low fluoride, and then later you can go to a high fluoride one. But brushing has to start when the first tooth comes in the mouth, because as soon as the tooth comes, it becomes a place where bacteria can go and sit. So 1 tooth or 2 teeth or 3 teeth, at any stage, at any number, the risk for decay is the same. So even a single tooth needs to be brushed, needs to be kept clean, and then make sure there's no plaque deposits. You can see the plaque deposits. If you don't brush for 2-3 days, you can start noticing a thin film of a yellowish colored tinge that starts appearing on the tooth. But again, it's soft, so if you brush it off, it's going to go away. So that will give you an idea whether the brushing is going properly or not. I think I answered Pooja's question there.
Thank you, Dr. Saranya. Neha says, is brushing twice enough, or should I get my child brush after every meal?
Typically, brushing twice is enough because during the day, even though they are eating a lot, they are also drinking water, and I think rinsing in between meals should be made mandatory. But brushing twice generally does the job unless the child is consuming too much of sweet food, sweet and sticky food, which does not go away with rinsing. Then it is okay. It is advisable that the child starts brushing in between also. But if it's regular food that the child takes, which gets cleaned away with just rinsing and mouth washes and everything, then you don't have to brush multiple times in a day. But brushing once in the morning, once in the night is more than enough.
Thank you, Dr. Saranya. Arup is asking this question, and Arup says, I see small black spots on my child's teeth. What do you think, doctor, those could be?
He's not mentioned how old the child is.
No, Arup, if you're watching this, please mention the age of the child. That would give us a better understanding. But so, Dr. Saranya, although I don't know the age, but if you could give a generic answer, considering the age would be 1 to 3 or 3 to 7.
So, black spots can be two things. One, it can just be stains. Sometimes some children have a layer of stains that form on the teeth, which are generally harmless, or they come secondary to taking supplements, iron syrups. That can also put some stains on the teeth, which are again harmless. They don't cause anything other than it's just something which is aesthetically not very pleasing. But other than that, that is not decay. But if you're seeing specific black spots in places where food also gets stuck, or if it's on the back teeth, or very one or two isolated spots here and there, then there is a very high chance that that is decay. Again, if it's just a small spot and there is no pain, there is no discomfort, there is no food getting stuck there, it is probably a very early stage of decay where we can just clean off that small tiny spot and put filling there so that it doesn't worsen. And at this stage, the child is going to be a little more comfortable with the procedure also. So if you see a hole, or if you see something where food is getting stuck, get it filled as soon as you can. But if the child is on supplements, or if it's just a stain that is there, or a small mark or a line, then it's most of the time it's harmless.
So Arup, we hope that answers your question. It is probably harmless. Yeah, if you have any more questions to add, please let us know. And Dr. Saranya, Marmiam Ahmed has the Marmiam says there are white spot on the new tooth of my 6-year-old. So we just got a question around black spots. This one is around white spots. And Mariam further adds, is there a problem that I should be worried about? And what should I do about these white spots? The child is 6 years old.
6 years old. So I'm thinking you have a concern over the white spots on the permanent teeth that have started coming in. So either white spots can be a lot of things. The most common one is it is either an early sign of decay, or if it is on the front teeth, then if there was a history of trauma, or the milk tooth fell off too early, or if the milk tooth had some sort of infection or a break, that could have left a small spot on the permanent tooth or somewhere on the edge of the permanent tooth. If it is anything else, sometimes the minerals that are there in the tooth, so the tooth is formed with a lot of things as calcium, fluoride, and multiple other minerals that are there in the teeth. Sometimes there are spots on the teeth where the minerals come out and the tooth structure is a little weaker. So if it is something like that, if it is an isolated spot, we generally just put a layer of fluoride or something on it clinically to prevent decay, prevent the susceptibility of decay, reduce the susceptibility of decay in that particular spot. But if it is a decay, if it's an early sign of decay, and if it's just a white spot, then generally it is reversible. If hygiene is good enough, if your child is brushing twice, and if you start regular fluoride applications. So fluoride application is it's like a layer of varnish, a paint that we coat on all the teeth once in a year or once in 6 months, depending on how much of a risk the child is at for decay. So if it's a high risk, sometimes we say 6 months. If there is a low risk, if the child is at a lower risk for decay, we say once in 1 year. So that is a preventive thing. We just paint it on all the teeth absorb all that fluoride, the resistance to decay increases, the strength of the tooth increases. So if the child is above 6 years, we can start with putting fluoride on the teeth and make sure that those white spots can get reversed.
Thank you. Thank you so much, Dr. Saranya. Dr. Saranya, please suggest 3 do's and 3 don'ts for healthy teeth in children.
Okay. 3 do's: brush. That is your primary, the main thing that you can do to keep teeth clean and avoid decay. Avoid frequent snackings. Limit the number of snackings. Once or twice a day is okay. Don't avoid snacking every 1 hour, every 30 minutes. And make your first visit to the pediatric dentist by the first birthday or when the first tooth comes in, whichever is earlier, and keep the visits regular. So if you go every 6 months, you go for a checkup, even if there is any sign of decay that is not very evident to you, if the dentist notices it, we can treat it early on so that the procedures and the child stays comfortable. We don't have to do anything too severe in the form of treatment. So if you have regular dental visits for just checkups and counseling, that will make sure that nothing untoward happens. These are your 3 major things that you need to do. Don't, again, avoid, like I said, avoid snacking, avoid sticky foods, avoid anything that is too processed, avoid too much of added sugar. Don't let the child get away with tantrums when it comes to brushing. I know it sounds really harsh, but then some things are just mandatory. We have to force it. We have to inculcate the habit. It's like any other good habit we would put in our child. And don't instill a fear of dentists. Don't go saying like doctor injection de denge and all those things. So the child, as long as the child is comfortable going to a dentist, most of the problems are just going to go away.
Thank you so much, Dr. Saranya, for all the information that you've given us today in this workshop. We are joined by Parentune expert, Dr. Saranya, pediatric dentist, and she's spoken about how to prevent tooth decay in your child in this workshop. Thank you again, Dr. Saranya, for giving out this valuable information.
Thank you.
We'll be back. Thank you. Thank you so much. We'll be back again on Saturday with a workshop in Hindi. Till then, please take good care of yourself and we'll see you on Saturday. Thank you. Thank you, Dr. Saranya.
Thank you.
People are isolated at their homes, and generally the people are living in a nuclear family, so they don't have people in the family itself to interact.
Here, it is very important as parents to first build a connect with the child. Start looking at all the positive things that your son has done.
Get him involved in some of the routines that may be interesting.
I think Parentune has this wonderful concept of called Parentune Live workshops. What's the objective of reaching out to Parentune?
So it is very important for child to listen a lot.
इतना समय हम इस पे बिताएंगे, इतना समय ये करने में बिताएंगे, थोड़ा बहुत ये स्ट्रक्चर लाना बहुत जरूरी है.